Medicaid on the chopping block. Why America's most popular program faces the unthinkable. The politics of this are so bad it blows my mind. That was CNN's senior political analyst Harry Enton reacting to what may be one of the most politically disastrous moves in recent Republican memory, cutting Medicaid. Yes, Medicaid, the lifeline for over 85 million Americans, a program more popular than almost anything else in American public life, and now, it's on the chopping block. As House Republicans push forward with their new tax reform bill, what Donald Trump proudly calls his big beautiful bill, they're not just slashing tax rates, they're targeting healthcare. Specifically, they're aiming to cut $880 billion from Medicaid over the next decade. Medicaid isn't some niche welfare program. It's one of the largest and most vital parts of the American healthcare system. It covers low-income families, pregnant women, seniors in nursing homes, and people with disabilities. Nearly 1 in 4 Americans are enrolled in Medicaid. That includes over 40% of all births in the United States, more than 60% of nursing home residents, and 1 in 3 children. In red states like Missouri, 1 in 5 people rely on Medicaid, including working families who simply can't afford private insurance. This isn't a distant issue, it's personal, it's everywhere. The Republican tax plan includes $880 billion in cuts to Medicaid over 10 years. It introduces new co-pay requirements, meaning even the poorest families would have to pay out of pocket for care. And it potentially eliminates federal funding for Medicaid expansion under the Affordable Care Act. What that means is simple millions of people could lose coverage, and those who don't could end up paying costs they can't afford. This isn't about streamlining government, it's about pulling healthcare away from the people who need it most. The backlash is historic. 76% of Americans oppose cuts to Medicaid. That includes 95% of Democrats, 79% of independents, and even 55% of Republicans. The opposition is bipartisan and overwhelming. Why? Because people know what's at stake. In a recent survey, 62% of both Democrats and Republicans said they or someone close to them relies on Medicaid. That's not ideology, that's reality. In a recent congressional committee hearing, Representative Alexandria Ocasio-Cortez spoke directly to the American people. There are 13.7 million Americans on the other side of that screen. Hello, I'm talking to you because I work for you. She pointed out that in some Republican districts up to 40% of residents rely on Medicaid, yet their representatives are voting to take it away. One Republican accused her of political theater, but the facts were already doing the heavy lifting. Senator Josh Hawley, a Trump-aligned Republican from Missouri, is breaking ranks with his party. In a New York Times op-ed he wrote, "It is wrong to cut health care for the working poor." He criticized the bill for punishing the very people Republicans claim to support working-class families. In Missouri, rural hospitals are already struggling to stay open. The introduction of co-pays could devastate those communities. Hawley warned that Republicans are risking their political identity. We're supposed to be the party of the working class, we need to act like it. The strategy is simple: cut social programs like Medicaid, use the savings to fund tax breaks, mostly for corporations and the wealthy, and package it as fiscal responsibility. Senator Hawley called it what it is: reverse class warfare. Other Republicans, including Thomas Massie and Chip Roy, warned the bill could add trillions to the debt while stripping health care from millions of families. Imagine a family of 4 in rural Missouri, 2 working parents, both on minimum wage, 1 child with asthma. Medicaid pays for the doctor visits and the medicine. Under this bill, they'd face $40 to $60 a month in co-pays. That's $700 a year they simply don't have. Multiply that by millions of families and you start to see the real impact. The bottom line. Cutting Medicaid doesn't reduce the deficit, it doesn't fix the economy. It just shifts the cost of healthcare onto the people who can't afford it. It's unpopular, it's unnecessary, and it's deeply unfair. From AOC's fiery speech to Josh Hawley's defiant op-ed, voices from both sides of the aisle are saying the same thing. Don't take healthcare away from the people who need it most just to give billionaires another tax break. Medicaid isn't just a policy, it's a promise. And breaking that promise could break something much deeper in this country. Thanks for watching.